Have you ever wondered how high blood pressure silently affects your brain and body? Especially after 60? Meet Mary, a 68-year-old woman who spent most of her life thinking high blood pressure was just another number on her doctor's chart. She felt fine, didn't worry much, and never thought it would become a real issue. But one morning, she woke up feeling dizzy and confused. It wasn't until she had a mild stroke that she realized how dangerous her untreated blood pressure was. That moment marked the turning point in her life. Mary decided to make a change. And with the right knowledge and habits, she's now living a healthier and more vibrant life. At Elderly Wisdom Secrets, we believe everyone deserves to take control of their health, no matter their age. In today's video, we're going to explore the crucial link between high blood pressure and stroke risk after 60. We'll uncover why high blood pressure is a major threat and, most importantly, show you how to manage it effectively to protect your brain and reduce the risk of stroke. The best part? You can start today, and the results will surprise you. Let's dive in and learn how small, everyday habits can make a big difference in your health. Understanding the silent killer, high blood pressure and stroke risk. James, 72, always thought he was doing everything right. He exercised regularly, ate well, and visited his doctor for checkups. But for years, he ignored the warnings about his rising blood pressure, dismissing them as a part of getting older. It wasn't until one day when he felt a strange dizziness and a mild headache that he realized the seriousness of his condition. James was shocked when his doctor told him that his high blood pressure was putting him at an incredibly high risk of stroke. He learned that high blood pressure doesn't just cause headaches or make you feel unwell, it damages your arteries, weakens the blood vessels that supply oxygen to your brain, and, over time, makes you more vulnerable to a stroke. According to the American Heart Association, high blood pressure is the leading cause of stroke, particularly after the age of 60. When your blood pressure is elevated, it puts extra strain on the heart and blood vessels, which can cause them to rupture or become blocked, leading to a stroke. The longer you go without managing high blood pressure, the greater your risk becomes. James was lucky, he caught it early. And with the right changes to his lifestyle and medication, he's able to manage his condition now. But many people don't realize the silent threat high blood pressure poses until it's too late. Now that we understand just how dangerous high blood pressure can be, let's move forward and explore how high blood pressure affects your brain, increasing your risk of stroke and cognitive decline. This is the moment to take control and start making changes that could protect your future. How high blood pressure affects your brain and increases stroke risk. Linda, 68, always prided herself on being active and healthy. She walked every morning, ate a balanced diet, and visited her doctor regularly. But as she got older, she noticed something strange. Her memory wasn't as sharp, and she felt more forgetful than usual. After a routine checkup, her doctor told her that her blood pressure had been steadily rising over the past few years. Linda was shocked to learn that high blood pressure wasn't just affecting her heart, it was slowly damaging the blood vessels in her brain. High blood pressure makes the blood vessels in your brain narrow, and over time, this reduces the blood flow to vital areas of the brain. The American Stroke Association explains that when blood flow is compromised, it increases the risk of both stroke and cognitive decline. Imagine your brain as a garden, and your blood vessels as the irrigation system. If the pipes get clogged or damaged, the plants, your brain cells, don't get the water they need to thrive. This results in brain fog, memory loss, and a greater likelihood of a stroke. Linda's experience opened her eyes to the reality that high blood pressure can have a silent yet devastating effect on the brain, contributing to both stroke risk and mental decline. But the good news is, these changes are reversible with the right interventions, including managing blood pressure and adopting healthier lifestyle habits. So now that we understand how high blood pressure damages the brain, Let's talk about how to spot the warning signs of a stroke, because the sooner you recognize the symptoms, the quicker you can get help, and the better your chances of preventing long-term damage. Warning signs of stroke. Recognizing the symptoms early. Robert, 80, had always been in good health. However, one morning, he woke up and noticed that his left arm felt strangely heavy, and his speech was slurred. At first, he brushed it off as a simple fatigue, but as the symptoms persisted, he started to feel anxious. His wife, noticing his struggle, immediately called for help. When the paramedics arrived, they confirmed that Robert was experiencing a stroke. Luckily, he received treatment quickly, and although he had some temporary weakness, he recovered with minimal lasting effects. This experience served as a crucial reminder. Recognizing the warning signs of a stroke early can mean the difference between life and death, or between full recovery and long-term disability. The American Stroke Association emphasizes that stroke symptoms usually appear suddenly and can affect various parts of the body. The most common signs include 1. Sudden numbness or weakness. This often affects one side of the body, such as a drooping face, numbness in the arm, or weakness in one leg. 2. Confusion or trouble speaking. If someone suddenly has difficulty understanding or forming words, or if their speech becomes slurred, it could be a sign of a stroke. 3. Vision problems. Sudden blurry or double vision, or even loss of vision in one or both eyes, should not be ignored. 4. Severe headache. A sudden, intense headache with no known cause could be a sign of a stroke, particularly if it's accompanied by other symptoms. 5. Trouble walking, difficulty balancing, dizziness, or a lack of coordination when walking can indicate a stroke, especially if it's sudden and unexplained. 6. Sudden confusion or disorientation. If a person suddenly seems confused, unable to understand or follow simple instructions, it may be a sign of a stroke affecting the brain's cognitive functions. 7. Loss of coordination or balance. Feeling unsteady, having trouble walking, or sudden clumsiness can point to a stroke, especially if it occurs suddenly. By recognizing these warning signs early, you can act quickly and get medical help right away. The quicker the treatment, the less damage occurs to the brain, and the greater the chances of a full recovery. Now that we know how to spot a stroke, let's take a closer look at how lifestyle changes can help you lower your blood pressure and reduce your stroke risk. Whether it's eating healthier, exercising, or managing stress, these changes can significantly improve your brain health and lower your chances of experiencing a stroke. Lifestyle changes to lower blood pressure and prevent stroke. Clara, 70, had always been an active person, but over the years, she noticed that her blood pressure was creeping up. Her doctor warned her about the risks of hypertension, but it wasn't until she learned about the connection between high blood pressure and stroke that she decided to make some serious changes. Clara began with small adjustments. She started walking every morning for 30 minutes, gradually replacing processed foods with heart-healthy meals like leafy greens, fish, and whole grains. She also made sure to reduce her sodium intake, cutting back on salt and incorporating more potassium-rich foods, like bananas and sweet potatoes, into her diet. The results were gradual, but profound. Clara noticed a significant drop in her blood pressure, and she felt more energized, clear-headed, and balanced. Her doctor was impressed with her progress, and most importantly, Clara felt more confident about her health. What's even more powerful is that studies show that these simple lifestyle changes can lower the risk of stroke by up to 30%. According to the Centers for Disease Control and Prevention, CDC, regular physical activity, a nutritious diet, stress management, and adequate sleep are all crucial in managing blood pressure and preventing stroke. Clara's story shows that taking control of your health doesn't require major changes or a complete overhaul of your lifestyle. Just by adopting small habits like walking, eating the right foods, and cutting back on salt, You can make a huge difference in lowering your blood pressure and protecting your brain. Now that we've seen how effective lifestyle changes can be in managing blood pressure, let's dive into another crucial aspect of stroke prevention: medications and medical support. When necessary, medications play an important role in managing high blood pressure, and we'll explore how they can work in tandem with healthy habits to keep you safe. Medications and medical support for managing high blood pressure. Mary, 72, had been trying to manage her high blood pressure with lifestyle changes for years. But despite her efforts, her readings remained high. She walked every day, ate healthy meals, and tried to manage her stress. But her blood pressure stubbornly stayed elevated. After discussing it with her doctor, Mary was prescribed medication to help lower her blood pressure. At first, she was hesitant. She worried about side effects and whether the medication would be a lifelong commitment. But after speaking with her doctor about the benefits, Mary learned that medications like ACE inhibitors, beta blockers, and diuretics could be crucial in lowering blood pressure and preventing stroke, especially when combined with healthy habits. Mary started her treatment, and within a few weeks, she noticed a real difference. Her blood pressure readings dropped, and she felt more in control of her health. Her doctor explained that while lifestyle changes are essential, medications can provide an extra layer of protection by directly targeting the underlying causes of high blood pressure. This combination of medication and lifestyle changes helped reduce Mary's stroke risk and gave her peace of mind knowing she was doing everything possible to protect her brain and body. According to the National Institutes of Health, NIH, for people with persistent high blood pressure, medication is often necessary to manage the condition effectively. These medications work to regulate the heart rate, relax blood vessels, or remove excess fluid, making it easier for the heart to pump blood and for the body to maintain a healthy blood pressure level. Now that we've covered how medications can support your efforts to manage high blood pressure, let's take a look at the final step to protect your brain: taking charge of your health today. Because even with lifestyle changes and medications, the key is staying proactive and consistent in your efforts to prevent stroke and maintain a healthy, sharp mind. Let's dive into the next section, where we'll discuss how to take immediate action and build lasting habits for brain health. As we've seen throughout this video, high blood pressure is not just a number, it's a silent threat that can lead to serious consequences like stroke, especially after 60. But the good news is that you have the power to take control. Whether it's through regular exercise, eating heart-healthy foods, managing stress, or working with your healthcare provider on the right medications, each small change you make today can reduce your risk of stroke tomorrow. Just like Mary, who took charge of her health with both lifestyle changes and the right medications, you too can protect your brain, your heart, and your future. It doesn't require drastic shifts. Start by monitoring your blood pressure, making healthier food choices, or simply getting moving each day. Over time, these small actions will add up, giving you the confidence and peace of mind to know that you are doing everything you can to stay healthy and reduce your stroke risk. At Elderly Wisdom Secrets, we believe in the power of consistent, simple habits to transform lives. Your brain health, your heart health, and your future are all within your control. Start today. Take that first step toward a healthier, more vibrant life. The smallest changes can make the biggest difference. So, what's your first step going to be? Will you start checking your blood pressure regularly? Take a brisk walk tomorrow morning? Or cut back on salt? Whatever it is, now is the time to take action. And remember, consistency is key. Your future self will thank you for the steps you take today.